Bismillah ar-Rahman ar-Rahim. Assalamu alaikum everyone and welcome to our series review. Today we have the series of books to review from the topic of public health. From the first 50 books that we have reviewed during the first part of the book in one activity, we have selected 4 of the books that are related to public health. The philosophy of public health, tobacco or health, and obesity prevention and public health. So we have split the topic today in 4 main areas. The first area is the philosophy of public health and why is it something that is important for organizations and for countries actually to plan for and strategize for. And then we looked at the top 2 burdens on healthcare, the tobacco and obesity, and of course we are going to touch as well on the depression and anxiety and mental disorders as also some of the very important points that we need to discuss as well when it comes to public health. And then we are going to look at global competitiveness and where are the gaps in terms of the public health strategies, specifically with an eye over the Middle East region. So we are going to look into that as well from a regional perspective. So let's start with the first point, which is the public health philosophy and why is it something important. When we discuss the point of public health, it is not something that is luxury, and public health is one of the areas that when we look at is dealing with 2 actually of the very important enablers of any strategic growth of any country. So if we look at the financial capital as the most focused upon point when we look at strategies for economic growth. Of course, when we speak about economy, everybody relates economy to finance and the power of money, the power of trading and all of that. And of course, this is right because the financial capital gets you the dollars, and this is something that everybody wants, and organizations across several countries they want that. However, all these studies and the rule of economy is based that financial capital is a byproduct. It's something that is produced through proper human capital and social capital, which is, by the way, a very logical equation. However, many people don't look at the logic. They look at the byproduct. They look at the outcome, which is the dollars. However, the real effort and the real product is actually the human capital and the social capital. If we get human capital and social capital proper, then they are the producers of financial capital, and they are the ones that can contribute to financial capital. And we have lots of examples in history from countries that had very poor financial capital. However, they have decided to go through human capital and social capital development, and they were able to massively create financial capital afterwards. 2 examples of those is Singapore, the great focus on human and social capital in Singapore, and South Korea. So the focus as well on human and social capital and how they focused on those 2 parts, and they were able to create financial capital afterwards. So the financial capital in many cases when we look at the public health is a byproduct of proper human and social capital. So if any organization or any country wants to achieve financial capital and financial wealth, the best way and the most sustainable way is always through proper human and social capital. And that's why public health is a very important part to discuss. It's a very strategic division of the thinking when we look at strategies and how to achieve long-term sustainable growth. It's always enabling the human and social capital, which is through proper public health planning. That's why when we look at the health rankings in terms of how do we look at several models of what are the health outcomes and how come we are able to achieve better public health. So the 2 main parameters, and this is one of the models that I really like when it comes to public health. when we look at any policies or any program that we want to implement in any country, it should always focus on the outcomes. And the outcomes are very simple. And that's why I really like this model. The outcome should be, mortality and morbidity. And both of those are very simple, the length of life and the quality of life. So it's how long you live and how well you live, so that you are able to be productive during your years of living. So it's not only about measuring years of life. And this model was developed by the University of Wisconsin, and there is a PHI, the Population Health Institute of the University of Wisconsin, and this is one of the models I really like because it's detailed and simple at the same time. So it's all about number of years people would live and the quality of the years that they live, so that they are able to be productive and exercise a productive life within the community. So if we look at the outcomes, they are a byproduct, again, like the economy is a byproduct of social and human capital. The health outcomes are byproducts of health factors. And here the PHI, the model, comes into dividing the health factors into health behaviors, clinical care, social and economical factors, and physical environment. And those, like we mentioned, they are related to length of life, but quality of life as well. So they look at the health factors in terms of the tobacco use, diet and exercise, and those are 2 points that we are going to talk about today. They are the 2 major threats to the public health across the world. Alcohol use and unsafe sex as well. So clinical care is the next, which is access to care and the quality of care. So again, this is related to hospitals, the number of hospitals, beds per population, number of beds per population, number of doctors per population, quality of medical education, and quality of accreditation and the auditing of the healthcare as well. So this is the clinical care part. Then social and economical factor, which is related to education, employment, income, family and social support, and community safety. So those are under the social and economical factors. And then physical environment, which is the environmental quality, quality of air, water, and soil and all of that, and built environment around the social community. So if you look at the factors here with an eye of analysis, so there is 50% related to mortality, so this is health and how we decrease the sort of factors that are affecting the life length of life for human beings, and 50% that are related to morbidity, which is the quality of life that people live in while they are alive. So this is how we look at the public health. It's not only about the direct factors, which are the majority of people. When we talk about public health, they immediately look at hospitals and look at medical treatment. This is 50% of the equation, because remember, big part of the public health is mental health. So if we look at the mental health, remember we discussed during our second 50 books actually. So we looked at the mental health, and according to the American Psychological Association, the mental health and depression is related to 50%. It's the approximately 50% of the reasons for the inability or disability of work. And it has been ranked as the #1 disability factor for the population, for the working population in the United States. So if we look at that sort of mental health, it is related a lot to other social factors that we are talking about, and those are the morbidity factors related to the absorption and resilience in education, the possibility and diversity and inclusiveness in terms of the employment, the income and fair income distribution, Social support for families, and you know, we know all of that. It relates a lot to counseling, coaching, as well as financial support as well. Community safety, and this relates to the decrease in terms of bad behaviors within a certain population in the public. We look at the percentage of bullying, harassment, school absorption, and all of that. And this is part of the community safety as well as education. So this point is really related into the quality of life as well as the other physical environment parts as well. So the question here that we always look at, do we live, you know, is public health, do we live it by chance or is it by choice? And this is a very nice point to look at. If we plan well for the, public health, then it becomes a choice. If we leave it to chance, then this is an area that many countries and many organizations might fail into. So when we look at that point, if we want to really have the public health as a strategic pillar, it needs to be a choice. And how do we make it a choice? When we look at the model itself of how public health is looked at from different levels. So different levels means that there are things that we cannot control because those are the biological immune system. This is related to a lot of things. You know, some of it we can control, some of it we cannot control. This means, you know, the immunity levels of people. Sometimes it's related to the genes, DNA, and of the generation. And those are things that we cannot control, despite that we can improve. We can try to improve the immune system as much as possible in the children, specifically with proper vaccination and proper access to medication and proper access to medical treatment and medical advice, medical counseling. So this is the biological part, and this is on the cell level. Now we come into the self itself, so human being, and this relates to behavior. So this is all about decisions that human beings are being able to make. And similar to that is smoking. An example of that is smoking, and also another example is the eating habits, drinking habits, and all of that. So this is the human behavior. Then the society, which is the third level, which is the social system, which relates to how clean is the society, the air, you know, the cars, the smoking, and all of those factors that are related to the pollution within the environment and within a certain community. And then we get, you know, the highest level, which is the system, which is again the how we put policies and procedures in order to control factors that are within the community. This is related to factories distribution. So where should factories be? Where should workshops be away from the community? You know, diesel engines, the electric vehicles and electric utilization of electric vehicles and all of that. So this is related to the policy on the macro level. So if we look at this model and the 4 levels of public health, it's actually only one of them that is semi not controlled. I'm saying semi because it's not totally not controlled, because there is something that we can do about it. Remember, we were talking about, is it chance or choice? And when we look at the chances, it is only small part of the cell because it's related to the hereditary factors, to the genes. This is the only area that it is by chance, not by choice. However, we can here improve as well the immune system through the immunization and eating and the proper access to proper nutrition. And then from self and society and the macro level, this is all choice. So if we look again at the equation of is it by chance or is it by choice, we see that it's approximately 90% through the choice and only 10% through the chance. Because at the end of the day, the only thing that we cannot control is the genes of someone who is newly born and genes of babies that are newly born. This is the only thing we cannot control. However, through proper immunization, through proper medical access and all of that, we can improve immunity on the long term. And then the rest of the levels, human behavior and social system and the macro system as well, all of this can be controlled. And when we look at the WHO, when they look at the most urgent, top urgent 10 public health or health challenges during 2020, we look at how they rank them. The elevating health in the climate debate. So it's all related to macro environment. It's something that people need to make a choice whether we want to continue using diesel, clean diesel. In Europe, lots of countries are now using the clean diesel, while this is something that needs to be reconsidered in several areas across Africa and the Middle East. Delivering health in conflict and crisis, and there are several countries that are facing conflict and crisis within the region. Making healthcare fairer, so the distribution of hospitals and healthcares and PHCs and nursing facilities and all of that, because yes, we have numbers, which is good numbers of doctors per population, number of hospitals per population. However, the distribution of the hospitals and the PHCs needs to be looked at. Expanding access to medicine, and again, it relates to the proper use of proper medication and vaccinations and all of that. And this relates to point number 5, which is infectious diseases, including COVID, of course. Preparing for epidemics, and this is the best year to look at what did we learn. Yesterday, there was a statement from WHO saying we are warning the world for another possible pandemics, and this is one of the things that we need to look at. What did we learn from COVID, and how can governments plan for the future when they look at the epidemics and pandemics? Protecting people from dangerous products. So this relates to the quality labs in municipalities and in the ministries of health. Example, when we look at how many people drink fizzy drinks and chocolate, and with all the adverts, there are so many different adverts on chocolates, sugary products, and on harmful products, especially the fizzy drinks. And we are going to talk today about the fizzy drinks and about the sugar intake, because sugar intake is as addictive as the tobacco, and those are two very dangerous addiction. And dangerous products are not only looking at products that are harmful to the health directly, like for example, carcinogenic colors and all of that. Of course, this is obvious. However, we also are looking at indirect danger, because sugar is good, but it's bad if it's overtaken. Same like meat intake, red meat intake, fats, lipids. And we are going to talk about that again when we talk about obesity today. Investing in the people who defend our health. So improving this part in terms of improving training facilities and research facilities for medical doctors and nurses and administration people as well. There is a question from Dr. Amal. This session is recorded. Yes, it is recorded, Dr. Amal, and it will be uploaded on the YouTube. So investing in people who defend our health, this is related to training centers and related as well to the research and development budget. In terms of what kind of training do we give to people, simulation training in order to be able to manage healthcare and public health in the best way. And as we discussed before, this is not only technical training, so it's not only about how to give injections and how to measure blood pressure and how to deal with injuries and this is of course for nursing, but also when we look at medicine, it's not about the technical learning only, but it needs to also about psychological learning and how to deal with people who are in panic mode, how to deal with people who are in pandemics and crisis, and how to deal with people who are coming with emergencies and all of that. Keeping adolescents safe, which is related again to lots of factors, health safety, but also mental health safety, which is related to bullying, harassment, and all of that. And then earning public trust, because of course, there are so many different factors that are affecting trust. And as we discussed in the leadership series, trust, according to Stephen Covey in his book Speed of Trust, is split into two, which is character and confidence. Character and competence. Competence is related to the quality of medical education and the quality of medical training and the quality of certificates that are earned from faculties of medicine, nursing, pharmacy, and all admin, even people who are working in the healthcare. But the character part is very important, and interviewing, and we spoke about that, the importance here, and there is a very big element here that we really need to look at, the trust. How is trust created within the medical or the public healthcare? If we apply the Stephen Covey model of trust, which is related to character and competence, we look at the character. So, the competence, we can say that the competence is to a great extent achieved. We trust in the medical education, and we trust in the quality of education within our universities and all of that. However, there is a look into the character, and there is here, I feel there is a very big gap here, because none of the medical colleges that at least I have interacted with across the major countries within the Middle East does a proper interviewing for people who want to join the faculties of medicine or nursing or pharmacy. Being one of the healthcare system, I have not been interviewed when I wanted to go to my university. And it was all about how competent are you in terms of your GPA post high school. And if you were competent, then you are you are admitted to the university. And the character was here a big miss. And this is one of the very important points that we need to discuss. When can we have proper interviewing, exactly like people and many faculties interview people who want to join the security forces, the army forces. Those are very important to interview to ensure that they are mentally fit to protect the community and carry weapons and do all of that. It's very important as well to run proper interviews to the faculties of medicine, of pharmacy, of nursing, of engineering. All of those are very important as well, because as the police officers, they are defending the community, and it is very important to ensure that they are mentally and socially fit to be in the role. Also, the medical field is doing a very critical role of protecting as well the human beings, and they are performing very dangerous operations and life-threatening calls that they have to make. So it's very important that we also run proper character analysis during interviews pre-joining the university. Many people say, where does discipline come from? And you remember Jim Collins in his book Good to Great said that in order for organizations to do a breakthrough success, they need to have discipline. Disciplined people, disciplined thoughts, and disciplined actions, according to Jim Collins. So exactly, if we want to earn trust for the public health, we need to get disciplined people, disciplined thoughts, and disciplined actions. And this will never happen unless we are able to do proper interviewing and character analysis prior to joining the university. And this is extremely important for that point. That exactly like Engineer Abu Shawish is saying, that it's very important to interview. Yes, I agree with that, and Randa does agree with that, and that is something very important for the role. Many people ask why do people who are officers have a lot of discipline? That's because they were very well selected, and they are also very well managed as well during the university time. So the outcome is always a well-disciplined human being at the end, and that's why it is very important, if we want to copy this model into other universities, proper interviewing. Why do you want to be a doctor? Why and what value are you going to bring? And the importance of directing people with character. So this is related to the point of trust. We've spent some time on that point because that's the least obvious in all of the other points. If we look at the 10 points that are highlighted by the WHO, majority of them are related directly to public health and medical access, while the number 10 is something that relates to non-medical point, which is related to trust. That's why we spend some time to look at that. Trust is a very important factor for the public health. So when we look at an example like cancer risk factors, again, we look at the model. Is it choice or chance? And when we look into the unmodifiable, which is, this is the chance because it's unmodifiable. So this is the, errors in DNA replication. But then if we look at the non-intrinsic factors, which are modifiable, whether partially or fully modifiable, it's related to hormones and growth factors and inflammation that we can modify partially, but also into tobacco use, into behaviors of people, the eating habits, exposure to radiation and chemical carcinogens, and all of those other factors which we can control through behavior and through behavior modification. In order for people to strategize for public health, there needs to be, this is the model that is usually used, which always they call it the 9 points. This, and of course the core is research. So sometimes it's 1 core and 9, or you can call it 10 points in general. So it starts with research, and this is the most important part of how good is the quality of research and data that you get, because based on the research, you start to assess. And then this is first step number 1, you monitor, and you are able to diagnose and investigate. So we want to have statistics in terms of, and that's why public health statistics is very important. And how many smokers do we have, in which age, which gender, which country, which city, which place, and how can we reduce it? There needs to be, based on that, we need to develop policies. For example, if we look at coffee shops that are available in many countries in the Middle East, under residential houses. So you can have a building that has residential places, but under which there is a coffee shop, and they are giving shisha and smoking and all of that. If we are able to get statistics, how many people living in those buildings are subject to cancer, or they have developed stage 1 cancer or stage 2, or COPD, chronic obstructive pulmonary disease disorders, or any of those lung or heart disorders that are related to smoking. If we are able to assess and we are able to get proper statistics, and of course this is just a small example, we can look at obesity, we can look at smoking, we can look at all the other risk factors that are related to public health, including mental health, because we can look as well, there might be a pattern that we are not recognizing. Like, for example, there might be a certain city or a district where the public schools are under too much pressure and we have more mental problems in this area than others. So again, in order to understand, we cannot do this without proper research. That's why research is in the core, and having statistics is in the core. And then based on that, we monitor, we diagnose, and maybe we develop policies. For example, if we discover that having coffee shops under residential buildings can cause an elevation of risk factor to cancer of 15%, then we say it is forbidden to have coffee shops under residential buildings, providing shisha, of course, or allowing smoking. So the policy development is always, that's why you see the arrows are from up to down. It is clockwise. Why is that? Because based on your assessment, you can develop your policy by saying, no coffee shops here, no shisha within this area, no smoking within this area. And then after you develop the policy by the Ministry of Health or public health authorities, what do? You collaborate with the law enforcement. So what is the law enforcement? You go to the police, you go to the civil defense, and the authorities that are related to the law enforcement. And then those are the ones who are going to enforce the law, apply penalties. Those who are breaking the rules or the policies, they are going to start to stop the services of renewal of licenses, all of those factors that are related to enforcing the policy to be applied. And then you evaluate what happened afterwards? So again, research is going to speak to you. So after we did those measures, did we decrease the exposure to cancer from 15% to 12% to 10%? So if yes, then it is going to be a successful policy, and then we continue the process of assessing research. So research is something that is ongoing, always research is ongoing, and then providing us with proper evaluation and proper monitoring, because based on that we are going to get the cycle of public health proper. So this is a very, very, very important cycle or model for public health, which is, by the way, everybody knows about it. The key here is the execution. And you remember when we spoke about the strategy series, the key here is execution and the ability to execute properly and to be able to dedicate the necessary resources in public health strategy execution. So let's talk about the first part in the public health. We have two main issues, tobacco and obesity. So let's start with tobacco. When we look into 2017, the tobacco statistics, and why I'm bringing this statistics for a certain reason. I'll explain it in a moment now. When we look at the number, the annual number of reported deaths attributed to smoking per 100,000 people, so we look at the red zones. The darker it gets to the red, you can see that the number is increasing. So despite that the majority of tobacco products are produced within the West, specifically two of the major tobacco organizations are in the United States, and they are exporting to the majority of the world with so many different products. The United States is much lower in consumption and much lower in terms of mortality rates due to death that's related to smoking. While the Middle East and Asia in specifically East Europe, Russia, China, and several countries within the Middle East are related to very high numbers of death due to smoking. And when we look also at the trends, what happened according to the WHO, US, UK, and China are declining, so going down step by step in the trends, while lots of developing countries and Asian countries, Indonesia, Egypt, and Nigeria, they are growing in terms of the adult smokers as a percentage of the population according to the WHO statistics. And this is one of the things that we see when we relate this. That's why USA has been able to decrease. So they went through the safer zone, relatively safer. They are not yet in the safe zone, but relatively safer zone, while the countries in the Middle East are going into the danger zone. Not all of them, of course, but the countries that are known for being massively populated, they are from the dark orange to the red, and this is very important. There is, Ahmed is saying that is it related to economic growth? Well, it's not related to much to the economic growth, Ahmed, because if you look at China, for example, as one of the countries that is massively growing in terms of the economy, they are really suffering from that. And also, when you look at India and Pakistan, again, the areas, they are growing economically, but again, they are suffering from that point. They are still in the dark orange zone, not in the safe zone, yellow zone. So this is one of the things when we look at how in the developing countries, how do we actually put the curve down and how do we decrease? Knowing that, how do we relate it again to the economic growth of the country, and of course it relates to organizations as well. When we look at the United States statistics in terms of the comparison of mortality for non-risk factors and economic cost analysis, so they looked at smoking. Smoking alone causes United States only a cost of $68 billion US dollars. It is in billion US dollars. This is related to direct and indirect costs, as well as loss of earnings, which are going to be tax payable and all of that. So the point is smoking, because of the cancer, costs the country 68 billion. If we do a quick calculation, the United States is approximately 330 million population. So if we divide the 68 billion over the 330, we will reach a figure close to 206 million dollars of loss per population if we look at the cost of smoking, because of the direct and indirect. You know, it's related to a lot of factors. When people are able to work, they are able to produce, and this production, they are able to enter into the cycle. You know, the economy, and this is how the public health relates to economy. Economy is a cycle. You know, there is a cycle of dollars, and this cycle is either inflated, you know, or sometimes it is deflated. So, you know, it goes smaller. So it can go smaller or it can go bigger. Depending on what? Depending on the number of dollars that are traded within the cycle. So if you trade lots of dollars within the cycle, then, you know, the cycle gets, you know, inflated. So you trade a lot. If you trade less, then the cycle gets deflated and it gets smaller. So if you trade less dollars, then the cycle gets smaller. So how do you get the cycle bigger? You get the cycle bigger simply by either increasing the trade value. So you increase the value. So for example, you increase the price. Instead of something that is costing $1, you make it cost $5, so that, you know, it inflates, it pushes the transaction value per transaction. Or you keep the value and you increase the number of users. You know, you increase the number of users. Which one is more sustainable? Of course, increasing the number of users. So if you increase the number of users, they will increase the number of transactions because they need to eat, drink, buy clothes, you know, go out and all of that. And this is a very sustainable economic growth, because the circle gets inflated, the economy cycle or the economy circle gets inflated in a healthy way because you have introduced more users. How do you introduce more users? Every user from those people needs to have a job in order to have dollars, because this dollar will not create. They need to work, they need to be healthy, they need to earn, there need to be proper jobs, and that's why public health is very important. So what happens if people are smoking? I'm just explaining how did they estimate this number of direct and indirect. When people are smoking, and, you know, because of the smoking effect on public health and on cancer and on lots of other pulmonary and cardiac diseases, people get out of jobs quicker, or they are unable to work longer years like the normal ones. And that's why there is also life loss, which relates to the morbidity due to smoking, and also productive, you know, the cost of illness. There is the productive time. So they are unproductive. On the contrary, they will go to the hospitals to take health care and to be treated. So they will, instead of bringing in dollars to the cycle, they are going to withdraw dollars from the cycle. So what will happen is they will come all of a sudden, instead of bringing in dollars, they are going to wipe away dollars. And this is one of the things that, you know, this is the public health and the smoking costs. So this is the estimated cost of the loss of value within the United States. If we look at Germany, Germany did the same, and they looked at smoking as well, and they said that it costs us 35 billion euros per year, and Germany population is very close to many of the Middle Eastern countries, because when we look into the population of Europe, many of the countries are related, are not more than 100 million. Germany is approximately 80 to 85 million, something like that. When we look at the cost of smoking into the health in Germany, it's 35 billion euros per year. And we are talking about many very big figures. So imagine, just as a point of reflection, if we are able to strategize public health better, how many billions of dollars or euros can we bring to our countries back, and we can help organizations, and we can help our countries be more productive and save more money. And this money is needed a lot for the development in many strategic projects that many organizations and many countries need during this time, regarding infrastructure development, healthcare development, and many economical projects that the countries need as they are developing their strategies to the future. So when we look into, Randa was saying a few minutes back that there is a physiological and psychological. So yes, it is true. The tobacco dependence, physiological, is related to addiction to nicotine, and this can be treated, with nicotine addiction products for medication for cessation of tobacco, of smoking. But the most important is the behavioral, because if we look at the majority, and here we need a lot of research in this field. Remember the 10 phases, the 10 points of the public health. The center is research plus 9 other areas. So when we look at the importance of behavioral research, many people go to smoke shisha, for example, not because they are addicted to nicotine. Many people do social smoking, which is they go to coffee shops and they go for a shisha smoking, not because they are addicted to nicotine, but it's just because it's a social thing, and it's exactly like having a cup of coffee. So it's becoming more behavioral, and this is what public health needs to a lot focus on. How do we make a behavioral change? Until today, I have not seen any advert or any project that is going on the TV or on the mass media saying that shisha smoking is extremely dangerous for your health, for your public, for the society, for the economy. This is a very important point to look at. It needs to be a condemned behavior. It needs to be a condemned behavior, and people need to look negatively at the smoking in order to remember the ladder of inference that we discussed, that was developed by Chris Argyris, and it was quoted by Peter Senge in his book, The Fifth Discipline. It's all about what people see. If we want to change behavior, then remember the steps. We need to change what people see. And if we change what people see, then it will form a pattern, and then this pattern will form a meaning, and then this meaning will form an assumption, and then this assumption will form a belief, and then this belief will affect the behavior. So if we want to change the behavior, we need to show people that this is something that is condemned and this is something that is bad, and that's the part for the smoking. When we look at obesity, so it's the second biggest dilemma. Dr. Amal is saying that it is very difficult to change the smoker behavior. Yes, I like what you're saying, Dr. Amal, because it's very difficult, but it's not impossible. So that's why we need to look at. Engineer Abu Shawish is also saying that certain social behaviors affect the mental health of people, and this is actually true. And that's why when we look at social behaviors like eating habits, and of course we discussed the mental health point, which is bullying, harassment, stereotyping, discrimination. All of those are key issues that we need to talk about, of course, when it comes to public health. Why we took the examples of tobacco and obesity, because they are the most the biggest on the burden of healthcare burden. When we look at obesity, for example, the overweight and obese population is really increasing, and the trend is increasing all across the world. But when we look into the world fattest countries, according to the Newsweek statistics, this is the overall percentage of obese people in the 100 most populated nations. So they look at the population per country, and the 100 most populated regions. So they look at it. And when we look into number 1 being Saudi Arabia, number 2 being Egypt, and then 4 comes South Africa, which is African country, and then 5 is Iraq, and then 7 UAE, So when we look into those ranks out of the most populated countries in the world, this is an alarming statistics that we need to look at. And obesity is a big issue across the region. When we look also at the children, and you know, here there is a question of how can developing countries, like for example, Egypt is a developing country, Iraq is a developing country, and they are less in terms of the GDP. How can they have the most obese people? So, you know, you expect that when people have lower GDP countries, that maybe they will have malnutrition, but you know, having the most obese, which means there is something wrong here in the equation. And when we look into the fattest children, again, we look at the childhood, again, in the same statistics in the top 100 most populated nations, Saudi Arabia comes number 2, UAE comes number 4, and then Egypt comes in number 7. And then, you know, again, 3 of the top positions, of the top 10 positions, are related to countries that are related in the Middle East. So the question is always coming, why is that? And the main reason, you know, of the obesity is the calories intake. You know, many people look into how many calories do we take every day. Sugar is one of the main reasons of why people get obesity. So in developing countries like Egypt, Iraq, and other areas, it is all about the number of cups of teas, coffees, and you know, that we drink every day. And people get you know, a normal, the recommended maximum, look at this figure, the maximum intake of added sugars for children from 2 to 18 years is 25 grams, which is 5 teaspoonfuls. How many chocolates do they eat every day? How many cups of sugared or flavored tea, even milk? Nowadays they put sugar on that, and all of that. It's something that is very, very, very dangerous. When we look at adults, it's 10 teaspoonfuls, so 50 grams. When we look at, again, the number of cups of tea that adults drink, coffee, and then this is only maybe cups of teas or coffee. If we say an average person would take 2 teaspoon sugars, so this means that the maximum can drink 5 cups of tea as total sugar. Can you imagine? I'm talking about total sugar. I'm not talking about only drinking. But if they have 5 cups of tea every day, this means nothing sugary within the day. So no kunafa, no baklawa, no chocolate, nothing during the day. If you get 5 cups of tea, then it's done. You are done, because this is the maximum intake of sugars for adults, 50 grams. Imagine, you know, the 1 glass of fizzy drink or cup of fizzy drink is equal to probably 1 hour within the gym. And again, let's review the chart, you know, that we have just discussed. Obesity, which is the second one, when we look into the United States, 41 billion US dollars lost again because of obesity. If we do a rough calculation, why did we choose the obesity and the smoking? Let's do a rough calculation. 68 and 41. So, you know, this figure is 109 billion in billion dollars in the United States. So if the United States, like we said, is 330 million. So if we take third of this figure, so let's say we take 33 billion, sorry. So it's 33 billion per 100 million population that we can save if we are able to help our countries. So it is very important to help our countries here. It's very important to look for the strategy. How can we be productive? And that's why, as healthcare professionals, we should not only be practicing the healthcare, but we should be focusing on how do we help our countries, because at the end of the day, you know, we have limited resources. We only need to redirect those resources. If we think that we can save our countries, every 100 million population. So if we look at a country like Egypt, for example, is approximately 100 million population. if we are able to give back the country 33 or maybe even half of this figure, we are not going to reach 100% efficiency. If we are able to reach third of this figure, if we are able to give back the country $10 billion, if we are able to reduce the smoking burden and the obesity burden, and we improve healthcare and exercise and healthy living, we are going to be able to give back the country $10 billion that the country is in massive need of in order to spend on the economical and on the infrastructure projects that are coming up in the country as well. Randa is saying that, you know, she tried to, there is a lot of people that they are trying to quit, but, you know, stress and mental health sometimes brings people back. And that's why we need regulation, Randa, you know, because it doesn't work only by policy. Remember the cycle, Randa. You remember the cycle that we mentioned. It's all about you assess first, and then this is the step number one. So this is step number one, assess. So research is in the core, and then you assess, and then you develop policies, and then you have enforcement. You know, you enforce the law. And that's why it is very important. You cannot work alone. Many people who say, for example, that we cannot stop smoking if there is a law to prevent shisha and to prevent you know, coffee shops from providing that, at least in certain areas, in certain, and by the way, this happened in many countries. I'll give you an example. In Saudi Arabia, they prohibited coffee shops downtown to have shisha, and then only they have to give it outside the Riyadh area, for example, in the central zone of Saudi Arabia. And this made it difficult for many people to go and smoke, you know, because they have to drive for a long hours. Again, so the point is, it needs policy is required, law enforcement is required. At the end of the day, if we are able to decrease the burden over our countries in obesity and on smoking, we are going to give back the country billions of US dollars that they can invest on infrastructure and economical projects. And now, specifically during the COVID times, countries need a lot of work, and you know, everyone is looking for how can we bring back the economy back to normal. This is the direct way for the economy, if we are able to reduce the burden over the healthcare of smoking and of obesity, according to statistics and according to well-made researchers across the world. We come back to the last part of the today's series. Engineer Abu Shawish first is saying that, you know, some unnecessary medication is sometimes prescribed by some physicians just for marketing. Of course, if we look at the healthcare system, there are lots of gaps that we need to fix, lots of them. But, you know, exactly like when we are looking into the, you know, the ship, you know, we have very big holes that we need to, you know, first we need to stop those. And then we have smaller ones everywhere. And then, you know, probably those we need to fix as well. The biggest is smoking and obesity, because, you know, it's again, if we look at how much do we need to improve the sports, and you know, we have a very good example in UAE that is starting this month. So in November, UAE is starting the 30 by 30 challenge, which is a nationwide activity that was developed by His Highness, the Crown Prince of Dubai, His Highness Sheikh Hamdan, in order to improve the fitness within the country, because it's very important to improve healthcare, to make people move, to make people healthy. It's very important. It's an initiative that is nationwide, and it is developed within Dubai, where people go to parks and they have exercising groups and all of that, of course, with applying the social distancing. So this is something, it's an example of a very good initiative that has been applied, that we can all learn from, of how important is it to ensure that people are healthy. I also remember in Egypt, several times we have seen Egyptian President Abdel Fattah al-Sisi, and he is cycling within the communities, trying to promote the importance of moving and being healthy and being fit as well. So this is very important to, again, a very good example when we look at it, in terms of promoting healthcare. However, this will not work without the public health collaboration. And that's why it is very important for the public health to look at means of how can we reduce tobacco and reduce obesity in order to improve and ensure that we are improving the country capital utilization. As we said, the economic capital is a byproduct of social capital and human capital. If we are able to improve social and human capital, the economic capital is going to be improved. We come to the last point, which is the Global Competitiveness Report 2019. This is the report that compares all the countries. It's produced by the World Economic Forum, which is based in Switzerland. It depends on 12 main pillars. So look at those symbols well, because we are going to look at them now. So the pillar 1 is institutions, efficiency of institutions. Pillar 2 is infrastructure, ICT adoption, macroeconomic stability. The health is in under human capital, and then skills. Pillar 7 is product market, labor market. 8, 9 financial system, market size. Number 10, 11 is business dynamism, and 12 is innovation capability. So this is those are the 12 pillars. And let's look at the latest one was 2019 report. If we look at the best achieving country, the top competitive country in the world, it comes as Singapore. Singapore one day was not a rich country at all, and they were suffering from many health and economical burdens. But through human and social capital, Singapore is an example of a country that has been able to achieve massive competitiveness across the world through human capital and through social capital. And they made this as an example. They are a case study. They are now number 1, the highest competitive in the world, even higher than the United States, UK, and Japan, and other countries as well, and even Switzerland as well. When we look at the lower to middle income, so we filter that, Indonesia becomes the highest, followed by Philippines, and then Morocco comes as the highest country within the Arab world, within the Middle Eastern world, followed by Tunisia, Egypt, and then Kenya in terms of total competitiveness in terms of the region. When we look at the Middle East and North Africa, Israel comes as the highest one, followed by the UAE, and then Qatar, and then Saudi Arabia. And then this is specifically with the Middle East. And then Egypt comes as 93, the ranking out of 141. The Lebanon comes as 88. And then the Kuwait comes at 46 as well. So the top performing 5 performing countries within the Middle East, Israel, UAE, Qatar, Saudi Arabia, and Bahrain, they are the top 5 in terms of total competitiveness. Let's look at healthcare. So healthcare, and by the way, before we leave here, really, it's really very nice and very proud to see countries from the Middle East with a ranking of the top 50 at least. So if we look at until this ranking, so we have Kuwait, Bahrain, Saudi Arabia, Qatar, UAE on very good ranks on the top 50 and the total competitiveness across the world. When we look at healthcare, the highest country that is in the pillar of healthcare is Spain. And then Singapore as well comes as number 1. So those are all in ties. They are achieving all 100 points out of 100 points. So you can see Singapore as well is number 1 with Japan, Hong Kong, and Spain. Very, very, very important to learn from those countries. And that's why, I wonder, when we look at the scholarships that we give to the public health, the scholarships that we are, when we are sending doctors abroad, when we are sending nurses and professors, and when we are sending people to do research abroad, I want to ask you a question. Are we sending any of our scholarships to those countries? It's very important to send them to those countries, the ones that have achieved top health. The majority, I see, the majority of scholarships are going to USA and to UK And again, of course, USA has extremely good healthcare system. UK has extremely good healthcare system. They have some of the best medical schools across the world. However, the system in Spain, Hong Kong, Japan, and Singapore has been able, according to the Global Competitiveness Index, to reach the highest competitive index in terms of life expectancy. And by the way, this is the measure they look at it, the HALE measure, which is Health Adjusted Life Expectancy. And this is the average number of years a newborn can expect to live in good health. And this is a very nice measure that is approved by the World Economic Forum as the base for evaluating the health competitiveness in countries. When we look at lower to middle income, we look at Tunisia as the highest country within the Middle East and Arabian countries, and then followed by Morocco, and then Egypt comes at the 104th position. So there is a lot to do here within this area. Tunisia is in more or less in a good shape, but it needs, of course, a lot of work. We want to be in the top 20, and this is one of the things that we can do. There is a lot to do in other areas as well within the organization. Professor Namet is saying that many researchers go to Japan. Yes, that's very, very, very good to hear, because we really need to learn how those people, if we want to be number one, and this is what we aim, then we need to learn how did those countries be able to do it, and we need to learn from their system and implement. When we look at Middle Eastern countries, again, we look at the top 5 within the region of Middle East, Africa. So Israel comes first, Kuwait, Qatar, Bahrain, and Jordan. They are the top 5 positions. And if we look at the ranking within the top 50, then we add Tunisia as well. There is a lot to do within all the other countries so that we are able to jump within the top 50, at least as a first step. Let's look at the quick comparisons of countries. So you will see here a diamond shape, and you will see a circle here. The diamond is the previous year and the previous edition, and the circle is this year. So if we look at the healthcare, so it's more or less in Egypt, more or less the same, little bit decline, but we need to, more or less the same. If we look at Lebanon, there is some sort of decline, but again, it is not big, but in the Global Competitive Index, a small decline is achieved through various factors. So it needs to be taken seriously as we need to climb up. However, Lebanon's score, if we look at the healthcare, is really good. So 82 is not bad at all, and they are in the 59th position. If we look at Kuwait, one of the best countries that are performing, you can see that they have jumped up over the years. So they are the 12th in terms of the ranking. This is excellent to see as a country that has been able to improve the healthcare system massively on the Global Competitiveness Index. Saudi Arabia is similar to Lebanon, very close, 58th position with 82, exactly the same. Like when we look, they were not in the, I did not, filter that in the comparison with last year. As well as the UAE, they are not bad, but of course UAE has the opportunity to be much better than that, because they are really good on all the other factors. If we look at UAE as being overall the 25th across the world in total competitiveness, this is one of the things that they can really improve on in terms of the healthcare system. When it comes to the COVID situation, UAE was one of the best countries that was able to manage COVID within the global pandemic, and they have achieved one of the lowest percentages of mortality rates, with only 0.36% of infected people that they go they have mortality rate, which is an excellent percentage when it is compared to the global pandemic, which is approximately 2%. So when we look at the UAE, I expect them within the 2020 report to have jumped because of that, to jump really high because of that management of COVID situation. So that was the brief of the 4 books that we have spoken about today. So the philosophy of public health, the tobacco or health, and the obesity prevention and public health. Those were the 4 books that we have summarized, along with certain supporting data from the Global Competitiveness Index and the World Economic Forum. So we will stop the recording now, and then we will start the discussions post lecture. And I'm sure that there will be lots of very interesting points to discuss.